All right. Thank you, everyone, for joining us for this next installment of the Inner Source Health webinar series. We're always trying to bring you some exciting information, and today is a really great example of that. We've got with us Dr. Dianna Cortese of Dentistry for Health NYC. I had the pleasure of speaking with Dr. Dianna, a couple of weeks ago, and I was just amazed by her understanding of this oral systemic link that I'm sure she'll be talking about. And really, she's truly on the cutting edge of biological and holistic dentistry. And I know as a provider at InnerSource, we get a lot of questions on, what sort of dentist should I see? And we've been referring patients to Dentistry for Health for a long time. But we thought it would be a really great opportunity for our patients to learn more about what biologic and holistic dentistry even is, to understand if it's the right fit for you. And so I just wanted to read a little bit of an intro so you know Dr. Cortese and learn a little bit more about her background. So Dr. Dianna Cortese is a board-certified general dentist, born, raised, and practicing currently in New York City. She graduated from the NYU College of Dentistry with honors in oral pathology and medicine and was the recipient of the American Academy of Oral Medicine Award. She completed her general practice residency at New York Presbyterian Brooklyn Methodist Hospital and has training in dental oncology. Dr. Cortese has achieved a SMART, which stands for Safe Mercury Amalgam Removal Technique, which I'm sure she'll be talking about, certification as an IAOMT member. She has a background and interest in biological, functional, and holistic dentistry. As a Healthy Start certified dentist, Dr. Cortese works with both children and adults to promote proper growth and development of the jaw and airway with a focus on sleep disorder breathing. Dr. Cortese understands the oral systemic connection, which I'm really thrilled to hear more about, and has a preventative-oriented approach to dentistry, which again falls in line with a lot of the work that we do at InnerSource. So we are absolutely thrilled to have Dr. Dianna joining us. And what we'll do is we'll have the webinar for about 20 minutes and save the questions in the end. If you have any questions, there's a chat box on Zoom. You can send them through, and I'll be reading them towards the end. So feel free to send them through as the thoughts pop up. And without further ado, Dr. Dianna Cortese.
Hi, everyone. Thank you for having me today, Dr. Kachko. This is a really, really exciting topic, and I hope you're ready to learn some life-changing information about a very important field of dentistry. So our topic today is, what is a holistic or biologic dentist, and do you need one? So we're going to be using those terms interchangeably today. So you're probably wondering who I am. So thank you, Dr. Kachko, for giving me such a great introduction. So I'm going to be telling you a little bit more about myself and how I became a holistic dentist in the first place. And of course, I'll explain what holistic dentistry is along the way. So my holistic journey started when I was in college, and I was very, very stressed about getting into dental school, and I was taking all the pre-med courses and doing research and all that kind of stuff. And soon enough, I became ill, and I kind of put taking care of my body on the back burner. And I ended up having some GI issues. So I went to a conventional GI doctor, and the doctor told me that I should be eating more fiber, and that I was going to need surgery in the future. So I took the doctor's advice, and I started incorporating more fiber into my diet. And however, my symptoms still persisted, and I wasn't too thrilled about heading down the road to surgery. So that's when I went to InnerSource Health for a second opinion, and Dr. Bongiorno and Dr. Kachko gave me some great advice that was really life-changing for me. And I was able to take control of my own health, and I used natural methods and diet and incorporated those changes into my life, and it has been amazing. And I haven't had any symptoms since, and here I am many years later, and I haven't had to have any surgery. So thank you so much, guys, for all of the stuff that you did for me. And it's actually funny, I remember going to Dr. Bongiorno while I was in dental school. And I remember asking him, I was like, you know what, do you know anything about, is there like a holistic dental field? Like, I really like what you guys are doing, and I really wish that I could empower my patients and do, you know, similar things that you guys do. And he was like, yeah, there is. And I was so excited about it. And that's when he referred me to Dentistry for Health. And here I am today. So what is holistic or biologic dentistry? So I think it's important to note that every holistic dentist is not exactly the same, and there might be some differences between them. So it's important to find a holistic dentist who's right for you and your specific situation. So in general, holistic dentistry uses a combination of modern dental practices with proven, long-established traditions of natural healing. And we take an organic approach that views oral health as one part of the patient's well-being. And that's really important. So how is holistic dentistry different from conventional dentistry? So dentists who have chosen to do holistic dentistry have the same trainings and the same degrees as traditional dentists, but more. Holistic dentistry encompasses overall health, including the same oral health area on which traditional dentists concentrate. And holistic practitioners focus on long-term preventative care, and that's key. And we prefer to use non-invasive procedures whenever it's possible to do so. Most holistic dentists are environmentally friendly or quote unquote green and take a green approach to dentistry. We do that at Dentistry for Health New York at the office that I work at, which we'll be talking a little bit about more afterwards. And this is really important, this message. We focus on the root cause of issues rather than only masking the symptoms. And we also place a large focus in reducing or avoiding toxicity. And like Dr. Kachko mentioned before, that oral systemic link, which we'll be speaking about on the next slide. And it's important to note that these divergent perspectives bring some real differences in the diagnosis, treatment planning, and practicing of dentistry. So what is the oral systemic link? So holistic healthcare goes a step beyond standard dentistry, which addresses only the patient's teeth. We also look at the systemic connection between your oral health and your overall body condition. So why is the oral systemic link so important? Here are just a few facts that I came across when I was making this presentation that I thought were pretty incredible. So here's how your mouth and gum disease is kind of connected to the rest of your body. So gum disease is linked with heart attacks, strokes, and blood vessel disease. Gum disease also increases your risk of Alzheimer's disease. It increases your risk for head and neck cancer, kidney, pancreatic, and breast cancers. If you have bleeding gums and diabetes, your risk of premature death increases as much as 700%. And oral bacteria are being found in brain tissue, heart vessels, joints, and many other parts of the body. So these oral bacteria have been shown they spread all throughout your body, so it doesn't only stay in your mouth. And that's really, really important. Another key aspect to the oral systemic link and health in general is nutrition. And nutritional deficiencies are actually now known to be a major cause of teeth and gum problems. And poor dietary habits contribute to poor oral health and systemic health. And I'm sure many people, like everyone's heard that added sugars will contribute for you getting cavities. And that's very, very true. However, the topic of dental cavities goes way beyond just avoiding sugars. And, I commonly hear statements every day from patients and my friends and my family saying, I brush my teeth twice a day, I floss, but I'm still getting cavities. So Fortunately, there are many other ways that you can make a difference and you can take control of your oral health. And for each patient at our office, we discuss diet and we work in conjunction with a functional health coach, a nutritionist, Dr. Vincent Esposito, who has a great dental-oriented approach to for those people who want to make positive lifestyle choices. And he also has some tasty recipes and kid-friendly nutritional recipes, and they're really awesome, and it's been awesome working with him. So our outlook at Dentistry for Health is to reduce inflammation and infections in the mouth. And we do so by using non-invasive gum or periodontal treatments. So we do the same treatment as conventional dentists, but we also incorporate herbal home periodontal treatment that will help restore your gums in a natural way. And we try this non-surgical treatment avoids pain, lengthy recovery times, and can also save you a lot of money. So here are just some of our focuses at Dentistry for Health New York. We focus a lot on pH balance. So we want to promote the body's self-repairing ability, and we want to try to avoid excess acidity. And for each patient, when you come in, we do a microbiome analysis. So we actually monitor the levels and the different types of the pathogenic oral bacteria in your mouth. And these bacteria have been proven to be a major cause of gum disease. We also do a saliva analysis for every patient. So we look at the constituents of your saliva and we see how it may be affecting your mouth. So less radiation equals healthier you. So we use digital radiographs at our office, and conventional x-rays typically have more radiation, and digital x-rays actually offer better clarity of the bones in the teeth while reducing the amounts of radiation, which is really, really important. We also offer special 3D imaging to identify hidden infections that sometimes conventional x-rays or 2D x-rays cannot visualize. And we also, on top of that, we incorporate herbal and nutritional support to combat any damage from radiation. We strive to use the least toxic and most biocompatible materials. So we use BPA-free composite fillings and sealants, metal-free crowns and bridges. We use ceramic implants, and so I don't know if you guys are aware, but there is actually a difference between traditional quote-unquote mercury-free aesthetic dentists that no longer place amalgam fillings and the dentists at our office at Dentistry for Health New York. The difference is that we consider ourselves quote-unquote mercury-safe dentists. So what does that mean? It just means that we use some rigorous steps and special techniques, such as the SMART protocol, which stands for Safe Mercury Amalgam Removal Technique. And we use that technique to remove existing amalgam fillings, or you might know amalgam fillings as like silver fillings or mercury fillings, in a safe way. And we're protecting you and our team from excessive exposure to heavy metals. Some additional dental services we offer: oral cancer screenings for every single patient, and that's very, very important. We incorporate homeopathy and herbal treatments. We also do TMJ, which is your temporal mandibular joint, and myofascial pain treatments. If you guys are unaware of this, it's platelet-rich fibrin, so it's actually a procedure where we take your stem cells and if we're doing any surgeries in the mouth, we actually put the stem cells into your bones and it helps heal very well. We use a pinhole technique for gum recession. We offer laser, cold sore, and herpes treatments. And we use thermography scans, which can spot inflammation in your mouth. And these scans are really, really great because there's no radiation involved with them. Our office aims to use environment, to have an environmentally friendly environment. What does that mean? Our planet is really, really important to us, as well as your health. And we use non-toxic painted walls with recycled denim wall insulation. We use furniture coverings made from recycled fabric. Our dental floors are covered with marmoleum. Our dental vacuums and water systems conserve large amounts of water. And our dental water systems are charcoal filtered from specially installed ozonation filters. And our filters are actually designed to eliminate chemicals that are normally found in New York City tap water and bacteria as well. And great news, we treat kids as well. So we do pediatric holistic dentistry here, and we also offer what's called the Healthy Start program. So this program aims to reduce sleep disordered breathing, and our appliances are used to correct poor oral habits in kids, such as mouth breathing and thumb sucking. And actually, this Healthy Start program, we have appliances that we could use for adults as well, if you have any of these similar issues. So this is my contact information. Our office is located on East 56th Street in Manhattan. Our phone number is listed below. Feel free to check out our website. And I wasn't able to cover a lot of information about our office and about holistic dentistry, but our website has a lot of great stuff that you could read up on. And feel free to email me with any questions, or if you're interested in being seen as a patient in our office.
Great. Thank you so much, Dianna. And I do see a couple more questions coming in. I'll ask the first, and I think that's really relevant to what you have on the screen. So obviously you guys are in New York City, and if people are tuning in and they're not in New York City or within reachable distance, how can people find a holistic dentist near them?
Okay, well, so if you would like, feel free to email me or give me a call, and I can help you find for you in your specific area a holistic dentist that has a lot of the same outlooks as we have. I'd be happy to help you. So
great. So that's even more than just a random Google search. So that's I'd certainly take her up on that offer. Another question just came in. Which toothpaste do you recommend?
Oh, that's a great question. And I actually get that all the time. So it's actually not a one size fits all issue. And each toothpaste actually differs in their ingredients. So at your appointment, we discuss options for you and give our recommendations for what we think is best in your specific situation.
Okay. So it sounds like just going to pick up some Toms at the health food store won't do it.
Yeah, I mean, it really just depends on your specific dental situation. So, okay. It is toothpaste is a medication, right? So it's different for every person.
Yeah. I'll actually interject with a question that a lot of my patients ask me. So in people who've got receding gums or bone loss, and their teeth are obviously unstable as a result, what's the approach? How do you guys think about that in terms of assessment to understand someone's risk and all those kinds of things, or to understand what the best treatment is? I know that's probably a really big question, but if you could just sort of lay out some of the facts, because a lot of the people I even see on the call have asked me that question.
Yeah, that's a really, really great question. So usually, we do a thorough exam in our office to see if you specifically have gum disease, and there's many, many different risk factors for gum disease. So a lot of the time it is the specific bacteria. So we do a thorough investigation of the specific microbiome in your mouth. And our goal is to kind of shift that microbiome. And while we do some surgical treatments if they're necessary, we also incorporate laser treatments, lots of herbal remedies. We look at your nutrition, we look at your diet, and there's many other factors that we look at to help you. And, our goal is, let's try to save, if you have gum disease and, you want to keep your teeth, we really want to help you save those teeth and lower your inflammation. And so I hope
so that's back to that oral systemic link. It all connects, I guess, in the end.
Yes.
Great. Another question here came in. Is a holistic dentist the same as a biomimetic dentist, a biomimetic dentist? Is that something you're aware of, Dr. Dianna?
I mean, They're similar. I guess holistic dentists use more homeopathy treatments, and biological, biomedic, that's a lot of focus on the oral systemic link. So you kind of want to find someone who incorporates both.
Mm-hmm. To have all the tools in your toolkit.
Yeah.
Understood. We've got another question. I see some people raising their hand. If you can just type your question into the chat box, that would be great. And if you're having trouble doing that, we might even open it up to the audience. But another question just came in around, everyone's talking about mercury and amalgam and the risks. Is it safe for everyone to do mercury removal, or should some people wait, or are there protocols or the things that you can do to make it more effective or safer?
Yeah, so that's where the SMART technique comes in. So we actually have a specific protocol for removing the amalgams in a safe way. And we actually work with InnerSource Health with you guys if the patient needs like systemic detoxification. And we usually work with physicians and diagnosing that as well, if the patient has anything.
Okay, great. I got another question that came in about receding gums. I think, was there anything else you wanted to add to that? You may have answered that at least in part.
Yes, actually it depends like which types of receding gums you have. That's why you have to come in and kind of get an exam. But we do what's called a surgical pinhole technique. So we can actually, it's pretty non-invasive. It sounds really crazy, but we kind of just poke a hole in your gum and move your gum upwards as well. So that if you have like sensitivity on your teeth because of recession, like it could really help with the side effects of that. Because it kind of covers up that outside layer of the tooth that's sensitive.
Okay, great. And a lot of these questions that are coming in, I think always in the end, the answer is you need to get a thorough assessment. So if people wanted to come in and to see you, are they calling the phone number on the screen, 212-973-9425?
Yes.
Okay, great. So certainly get a personalized assessment and recommendation.
Yes, and actually I take insurance, so I know that's helpful for a lot of people.
That's a big deal.
Yeah, it is. I know it's so hard to find holistic dentists to take insurance, and yeah.
Yeah, we've been referring patients, but to have that option is really a game changer. So thank you for doing that. I know it often leads to a lot of headache and all those kinds of things. Yeah. Actually, very timely, another question just came in. For regular cleaning, what does Dentistry for Health do differently than a quote-unquote regular dentist?
Yeah, that's a great question. So our cleaning protocol, our periodontal, so that means your gums, we do a thorough gum assessment, like I said before. So the type of cleaning really depends on your periodontal status. So some cleanings might be more invasive than other cleanings. We do use all natural products for our cleanings, and yeah, we use Ozone as well. If that helps.
Ozone's great. Yeah.
Yeah, it really just depends on the specific situation. So it's kind of a broad question, but yeah, I hope that answers your question.
Yeah, hopefully it did. And one more that I'm actually also interested in. So this question came in about, I think we alluded to the Healthy Start program, and we've always got patients who are coming in, and I'm assuming that's mostly for kids. We definitely want to make sure that their oral health is what it needs to be from day one. So can you just speak to that program a little bit?
Yeah, so these appliances are really great, and they're made to improve sleep disorder breathing and like abnormal bites, if that makes sense. So what the appliances do is they expand the dental arches. They really encourage nasal breathing. So a lot of people breathe out of their mouth, but that's not necessarily great for your oral health. It could lead to dry mouth, and you can be at higher risk for getting cavities. So we like to encourage nasal breathing from a young age for the children. These devices also train the tongue to be sitting in your mouth properly, which actually can help dictate the shape of your jaw as you get older. And these appliances eliminate a lot of bad habits, such as thumb sucking, tongue thrust, which is kind of when you swallow, you push your tongue to the front of your mouth. And these devices are really, really of great quality. So there's no latex, no silicone in them. They're phthalate free, BPA and BPS free, and they're FDA cleared as well. So pretty much, I mean, you'd be really surprised to see how many children display signs of sleep disorder breathing. So if you guys are interested at all, if you go to the Healthy Start, I think it's thehealthystart.com. The website is really great, and they have a lot of educational, informational videos for parents. And there's like a survey online, so you can see if your child exhibits any of these signs. And then you can come in and we'll do a thorough dental exam to see if you qualify for the appliances. So
cool. I know you guys also work with sort of alternatives to CPAP machines, and you do some palate moving devices for adults. Can you speak to that a little bit as far as how people can think about that and know if that's possibly an option for them?
Yeah, sure. So usually what we recommend is you should go to a physician and get a sleep test done. And what they'll do is they will send us kind of the results. And according to the results, if your sleep apnea is really, really severe, they give you what's called a CPAP machine. So it's kind of like this device that goes over your nose and mouth, and that's how it helps you breathe at night. But some people are really unable to tolerate this device, and they want a dental appliance, kind of just like, it's like a retainer essentially, that helps move your jaw like forward and keep it from dropping backwards. So this Healthy Start program does make devices for adults as well, with the same materials. They're really, really great. And we do, so pretty much the same. The appliances are different because when you're younger, you're kind of growing and developing. So they're a little different than the adult devices, but yes, we can do a mouth guard for you as well.
Cool. And then is that similar to the types of mouth guards you guys would use for people who grind at night?
Yeah, it's something similar to that. Yeah.
Okay.
So, yeah.
And for teeth grinding, do you use the same kind of sort of mouth guards that, again, a quote unquote regular dentist would use, or is there something that people should be thinking about grinding their teeth beyond that? That's another question I know. It just came in, but a lot of my patients ask me.
Yeah, so tooth grinding is like a huge issue, and it's very, very relevant. So again, we do this Healthy Start program does have devices for that specific situation. And yeah, we do use safer materials for our retainers.
Okay, that's great. We'll take this one last question, and then I just want to give you a chance to, add in anything else that you want. So the last question is, I guess when you go to a regular dentist and they're working on you, sometimes they'll do injections to numb that area, to numb the nerve. Do you guys take a similar approach? Do you use safer materials? How do you get the teeth to be numb when needed?
Oh, yeah, that's a great question. So we use a lot of herbal remedies. So we can do conventional. So if you want the regular types of shots, that's totally fine. We can do that for you also. We tried not to use epinephrine in our injection material. And yes, we aim to use the least toxic methods of doing so.
Got it. So a completely holistic approach. Well, thank you so much. Like I said, anything else you want to add for the listeners? And remember, this will be recorded and it'll be out in the internet ether forever. So feel free to add whatever it is that you want people in 1,000 years to hear.
Well, I just wanted to say thank you for coming out, and I hope this was helpful for you. And if you have any questions, don't hesitate to reach out to me. I'd be happy to help.
Great. And on behalf of InnerSource Health, thank you so much, Dr. Dianna, for taking the time and educating our patients on this absolutely essential component of whole body health. Oral health is totally necessary in treating that. I treat a lot of heart disease and Alzheimer's, and unless people's oral microbiome is where it needs to be and their inflammation isn't reduced, it's really hard to make a lot of progress. So it's so important. So thank you again.
Yeah, no problem. Thank you.
Okay. All right. Bye, everyone.
Bye, guys.